Hello there, I'm Dr. Steve Tashiro. I'm here to share with you some information about a remarkable system of health assessment and support named Field Control Therapy, or FCT. Field Control Therapy was developed by Dr. Savely Yurkovsky. He's a cardiologist in New York, and he was trained in allopathic cardiology and practiced that way until he became an alternative medical practitioner. Began doing chelation with his patients, and one day one of his family members became gravely ill. And using the tools that he had learned, both allopathic and alternative, he was unable to help his family member. So he began a feverish search for a better system of analysis and support. And out of that came field control therapy. Now, one of the interesting findings he made as he was doing alternative cardiology therapy, especially chelation therapy, and by the way, chelation is a process of injecting a substance into the blood, a chelator like EDTA, that grabs onto toxic molecules, especially metals, to remove them from the blood. So Dr. Yurkovsky was doing this with many patients, and he began to see a trend that disturbed him greatly. And the trend was, going through chelation therapy, patients would start feeling better, then they would feel really good. But then after maybe 6 months or so, their symptoms would start coming back. And when he would evaluate the blood, he would find that the same toxins, metals and other toxins that he had done the chelation for, were back in the blood. So he began to realize that these were coming from storage sites in organs, in the fatty tissue in organs, as well as bone marrow, and including the brain. So out of that, again, he was motivated to find a better way of assessing and supporting his patients. Okay, in field control therapy, the focus is identifying which organs and tissues in the body are functioning at less than an optimal level. And also, what are the pernicious agents or toxic harmful agents that are creating that less than optimal function. And to summarize the pernicious agent pattern, imagine a triangle. And one point of the triangle would be toxins from the environment, metals being a primary one, but other toxins such as pesticides, medication, antibiotics, and other environmental toxins. Another point of the triangle would be infections like candida, virus, bacteria, parasites, flukes, any kind of infection. And the other point of the triangle would be electromagnetic toxicity. And this would relate to the exposure to electromagnetic fields that we get from computers, cell phones, microwave ovens, even driving our vehicles. And so these are the deadly triad, and each of these three aspects reinforces the presence of the other in the body. So really, unless you address all of them, it's hard to remove any one of them. Now, a lot of our patients come into the office taking a lot of food supplements, and in spite of that, they have tons of symptoms. So what's happening here is GI absorption is very poor, but also the ability of the cell membranes throughout the body to take in those nutrients is compromised because the nutrient receptors on the cell membranes have been damaged. Not only damaged chemically, but damaged by electromagnetic stresses. Because in order for a nutrient to be taken into a cell, there has to be an exchange of information via electrical signals. And if we have been bombarded with electromagnetic fields, like we use a computer every day, then those absorption sites get compromised. And so we need a method of assessment that allows us to bypass these problems that are so common. And that's what field control therapy provides. The way we support the body with field control therapy is what's called informational medicine remedies. These are remedies that contain the electrical frequency of the tissue we want to support. In his book, Energy Medicine, The Scientific Basis, Richard Oshman describes the fact that every cell and organ and tissue in our body has a resonant frequency, that is, an electrical signal that it emits as part of its healthy function. And that's how cells communicate with each other, through these electrical signals. So let's say that the electrical signal or frequency of your brain cell is here. But let's say that you've had trauma or toxicity affecting your brain, so now your brain cells are vibrating at this level. And by the way, cancer cells have no vibration, and it has been recognized and found that unhealthy tissue vibrates at a different rate than the same tissue when it's healthy. So in these informational medicine remedies, we introduce into the body a remedy carrying the frequency of healthy tissue vibration. Based on the principle of resonance, the unhealthy tissue begins to vibrate or resonate at that healthy ideal frequency. So that's a summary of how those remedies work. Now, I'm going to do a demonstration showing you how we go about doing the actual assessment to identify which organs and tissues are compromised, and then that leads to the formulation of these powerful information medicine remedies. This is Jennifer, and she's our demonstration patient. So this is how the field control therapy testing is done. There's actually two ways that we do the test. Patient holds this metal rod, which is attached by this wire to this metal plate or honeycomb. This is a vial that we use for testing. We have hundreds of these vials. Now this vial contains water that is embedded with the electrical frequency of healthy brain tissue. So I'm going to place this vial on the plate, and because the plate is metal, the plate amplifies the electrical signal in the vial. So now that electrical signal is traveling into Jennifer's body through this wire and the electrode she's holding. If the signal coming from her brain tissue is the same as the signal coming from that vial, and by the way, the vial contains a signal of healthy brain tissue, and the vial, by the way, was made with a tissue slide. So if the signal coming from her body is equal to the signal from that vial, she will remain in strength. But if her signal is different because her brain tissue is not healthy, there's a discord, and she will go into what's called a stress response that will create a weakness. So this is what it might look like if there was a stress response or weakness. Resist as I push. The arm will actually become weak. So then we would prepare a remedy, actually using the vial of healthy tissue, and we can determine the appropriate potency for that remedy in order to help revitalize her brain tissue. So this is one way of testing. Then the other way is with the patient lying on her back, and we'll demonstrate that next. Okay, so if we were to test Jennifer lying on her back, we would have her hold the metal rod in her right hand, and I would place the tissue vial on the honeycomb. Now, instead of testing for the response in her arm or shoulder, what I'm looking at is the positioning of my thumbs on her ankles. The beginning point is my thumbs are equal, or they're lined up, and if there's a stress response to this vial, the right leg becomes shorter. And it's interesting that it's always the right leg, no matter what the patient is or who the patient is. So if there is a stress response, in other words, if the signal coming from her brain does not match that of the healthy brain tissue, the right leg will become shorter, visibly shorter, and that tells me that there's a problem there. However, if the signal coming from her brain tissue is equal to the same as that from the healthy tissue vial, there's no stress response, and my thumbs remain lined up. So when we do ear assessment, we will do one of those two methods, depending on arm strength, ability to stand for 20 or 30 minutes, and some other factors as well. In either case, both methods are painless and totally non-invasive. So let's talk about the process of going through assessment and support with FCT. It generally takes 6 to 12 months for a person to go through approximately monthly sessions in order to reach a point of stability where they can then go on to more of a maintenance program where we would see them and provide appropriate remedies once a quarter. But the long-term benefits of that process are just tremendous. In his office in New York, Dr. Yurkovsky has found that people that have gone through this whole cycle of sessions and support and then gone into maintenance care have remarkably fewer medication needs, hospitalization needs, and surgery needs, even in their 60s, 70s, 80s, and 90 years of age. So this is a system that's very powerful for improving longevity as well as health and function. Now here's a very striking story that came out of Dr. Yurkovsky's recent webinar. He described a student who was a chiropractor, by the way, 50 years of age, eating a good diet, reinforced with supplements, and this chiropractor was learning how to apply field control therapy with his patients. And the experienced field control therapy instructor tested this chiropractor and found the presence of metals in his coronary arteries. And even though the experienced FCT practitioner made the appropriate recommendations, for some reason the student, the chiropractor, did not follow through with those recommendations. And then it was only a few months later that this chiropractor died of a massive heart attack. So he had no prior symptoms, and the FCT system of analysis, being as specific as it is, was able to identify this lethal problem that eventually took his life. So field control therapy is excellent not only for addressing known active problems, but for preventing bad things from happening that we don't even know are potential. So let's talk about what you may experience when you go onto the field control remedies. There's 3 likely outcomes. Number 1, you may feel tired and fatigued, even have cold flu symptoms, as the remedies give the organs the energy they need to start a process of detoxification. If this has happened, you should definitely rest, drink plenty of water, and let the healing process continue. Possibility number 2, you might have an increase of energy because these remedies increase the vital strength of remedies. That increase of energy might then be followed by a gradual decline of energy going into those symptoms of cold and flu, because now the organs being energized are releasing toxicity. And then possibility number 3, you might not notice a dramatic change one way or the other. All 3 of these occur, and they're all 3 acceptable and a normal part of the healing process. And so we have written information about field control therapy. Feel free to ask for that if you'd like more information. But I am very excited about sharing this powerful system of healing and support with you, and I look forward to doing your first field control assessment.